Welcome everyone. Finally, we are at the one of the last session of the Dystonia education series. And thank you for joining us for last three sessions. Hope it really helped you with practical tools, some learning, education, uh, and we'll continue our learning and sharing as we find more opportunities. So today's session is primarily focused around lifestyle intervention and holistic care by Dr. Hogan. It's going to be educational and not a substitute for medical advice. So, we really encourage you to stay curious, ask questions, and take full advantage of this opportunity to learn. And it's really exciting to close the series with a focus on lifestyle intervention and holistic care in dystonia management, a topic championed by our final speaker, Dr. Patrick Hogan. I would like to introduce Dr. Patrick Hogan. It's absolutely an honor to welcome Dr. Pat Hogan today, a pioneer in Washington's private neurology care. Dr. Hogan has been in practice since 1988 and currently serves as the director of Puget Sound Neurology. He is nationally recognized expert in movement disorder and was the first neurologist in the state trained in Botox therapy for neurological conditions, now treating the largest number of patients with this method in the Northwest. Dr. Hogan is a passionate advocate for integrating active lifestyle into the management of dystonia and other neurological conditions, emphasizing a holistic patient centered approach that blends medical and lifestyle intervention. Outside the clinic, he is an accomplished endurance athlete, a strong advocate for work life balance, and an enthusiastic human being. It's a privilege to call him a mentor and dear friend. Please join me in welcoming Dr. Pat Hogan.
Thank you, Prabha. Can everybody hear me okay? Wave your hands. Yeah, good. Well, it's a pleasure to speak here today because for anybody that is on, they obviously wants to improve their overall health and their improvement of their dystonia. And what we're going to talk today about is not just controlling the lifestyle factors related to dystonia, but also just for improving just a healthier brain, which then leads to a healthier, more dystonia. And people often don't think about the brain very much. We think about the general health and in general, but it's really a matter of really kind of giving love to your brain. Now we're going to talk about what you actually can do with the science-based evidence of what we can do ourselves for helping dystonia. And we know from your previous lectures, that dystonia is this network problem in the brain, not just one problem, but a problem with interaction with a number of different networks that really results in this imbalance between the excitatory and inhibitory pathways. So that the energy from the brain, instead of like a nice stream of energy coming down, we're getting in this river of energy that's flowing down to the wrong places. And so it becomes a matter of almost like a teeter-totter of having too much acceleration and not enough brakes. And we want to try to bring that balance between the acceleration pedal and the brake pedal back into more normal balance. And for those people that are fortunate enough to have a sensory trick, we know that can happen. We know that if by putting the right type of sensation into the neck or onto the face or eyes, we often can calm down that imbalance. And what we want to do with our therapy is a similar thing. We want to find some way of producing that balance. And so we have this whole general medical care that you obviously are very well familiar with the botulinum toxins, the medication, surgery options. We're now becoming, really enamored with transcranial magnetic stimulation, which has shown some really good benefit for a number of people. And we're hoping to have the formal indication, but people have been able to get this in other ways, and it has definitely helped their dystonia. But a major component of our treatment program should be lifestyle medicine. And there's a whole organization of lifestyle medicine of lifestyle medicine practitioners on lifestylemedicine.org. And so it's well recognized that this can have a major impact, not just on your brain, as we're going to be talking about today, but for the whole body, including the heart and so forth. And obviously, heart health is pretty important for the brain health because if the heart doesn't work, your brain's not working. So it's all together. It all works together. But what we're going to be talking about is this whole idea that if we can improve the health of your brain, we can improve the health of your dystonia, better control of your dystonia. And improving your brain health comes down to improving a healthier mind as well as a healthier body. They have kind of work together, leading to this healthier brain, all leading to what's called neuroplasticity. And I'm sure, Purva talks about it, neuroplasticity frequently, as we'll get to more. And the whole idea that if we can do the right combination of factors, we can produce this neuroplasticity where we actually can help change those circuits that we were talking about that are overactive to help calm things down and put a balancing effect. But because the brain is not a solid structure, a stable structure. It's a very dynamic structure that changes in a continual manner and in response to our experiences. And so we have the capacity with the right type of stimulus to help change our brain for the better or the worse if you have the wrong experiences, the bad stress and the inactivity, things that can actually worsen the brain. But we want to try to promote it along so that we improve your brain health to produce a greater level of dystonia control and just general brain health. So we have the pillars of lifestyle medicine that the lifestyle practitioners discuss about with activity and sleep and stress management. But today we're going to just kind of delve into some other specifics, more the exercise, yoga, meditation, breathing exercises, sleep, nutrition, social impact, and our mindset. It's very important, our positive attitude and mindset. Each one of these, we could have a seminar, basically, our whole lecture for one on things. So I can touch on each one of these just to give you the motivation to realize that there's more study on each of these to understand how we have an impact to our brains, which actually improves our brain function and improves our health. And a lot of it, because a lot of this is going to come down to, and many of the things we're talking about is just what is decreasing what can make dystonia worse. And everyone knows that when you're under greater stress or not sleeping well or have illness, anything puts a greater strain on your brain is going to amplify that energy coming out of your brain to your muscles. And so we want to try to decrease that stress in the brain, increase what makes the dystonia better, which we learn now has been exercise, nutrition, sleep, and other things we'll talk about today, all with the purpose of helping neuroplasticity. The other underlying message that we see with just about all of these things throughout our whole body and the brain is inflammation. They even call it inflammaging because inflammation is a big keys between aging process in our body. And about everything we're talking about, underlying it, there's a level of the wrong activities that can produce inflammation, which has a major impact on our brain. And as our brain is under more inflammation and more impact, it can worsen our dystonia. So we're going to talk about what we can do to enhance our neuroplasticity. And the big one is exercise. And people kind of balk at this, say, "Oh, I've heard exercise is good. I can't redo it because of my condition." But there's an element of this for everybody because we think of exercise so often as working your muscles, but we have to think about it a different way. We have to reframe it totally. That every time we do any exercise, we are exercising our brain. Our brain. The message is going back from our muscles back up to the nerve impulses up to our brain and enhancing our brain function to the point that we can really think of this exercise as a medicine. It really is true. It produces, we'll talk about that in a minute, why it's a medicine, but it produces more than any other medication or surgery or botulinum toxin that it possibly can do, because it produces, the muscle control, it reduces pain, improves our alignment. With inalignmovement.com, you can hear more about that. Improve neuroplasticity, of course, our mental health. All these things are impaired with dystonia. Our sleep is impaired with dystonia. Social interaction is often impaired. Our balance in equilibrium is impaired with everybody with dystonia. All these things are helped with medicine, then with the medicine of exercise. And in fact, to the point that we call this medicine does it all. Does it all is like is a brand name of this medication, because it does this, and it needs, so any medicine needs a name. And so we could think of this, and the whole point of that is that when you're exercising, then it doesn't just feel like you're exercising these muscles that hurt, that you're actually producing a medicine in your system that's feeding back to your brain, which then produces all these positive effects. And we could talk about each one of these in detail, but just to recognize that it occurs, and you can learn more and more about each one of these as we go along. But in the other reason why it's really like a medicine, because when you take a regular medicine, you're producing a chemical effect in your body. Well, the same thing happens with exercise. Exercise activates this chemical called BDNF, brain-derived neurotrophic factor, that feeds back to your brain like a fertilizer for your brain. It enhances the connections between the neurons and helps to rewire the brain to produce a better control of dystonia and improvement of pain. This brain-derived neurotrophic factor is really truly can think of it as a chemical process that you only can get with exercise. You can enhance it with certain things that we'll talk about with diet and meditation example, but you only can activate it with exercise, especially the large muscles. Activated by large muscles that are in your butt and your legs are the biggest muscles. By exercising those muscles, that triggers this chemical. So we'll get back into that more. But all these things give you motivation, because it's difficult. Everybody knows that it's difficult to exercise and it's uncomfortable, but a person needs a motivation to know that they're not just exercising to make their muscles stronger, that they're exercising for their brain function and to help your dystonia and to prevent injury. People, as time goes on, every single person loses a balance. And with dystonia, it doubles it. Everyone with dystonia has trouble with balance difficulties. And that's a real harm, of potentially falling. The hips and the legs and the abdominal area all can help prevent the falls and loss of balance, as well as activating that BDNF and helping your brain. So we generally recommend, the basics for everyone when anyone exercises or recommends exercise for anything in the entire body, is to get that combination of aerobic exercise, 150 minutes per week, spread out throughout the week, which means an exercise that gets your heart rate going somewhat, and you're moving your whole body. The whole concept. Few steps. It could be, an exercise bike. It could be and then there's resistance training, doing something that actually strengthens your muscles, which then thereby triggers to your brain. Stretch bands, weight machines, and people usually need guidance on how to do it. And if you had a choice, and we want to do all three of these, but if you had a choice, now they're recognizing that the type of exercise that seems to have the greatest benefit to the brain is this resistant exercise, something that puts a strain on your muscles that feeds back to your brain, and then and produces this stability in your body to help prevent frailty. And that's what happens without it. People get more and more frail over time, and worsening the ability to move. And then balance exercises. We'll talk about yoga and dance or physical therapy guidance, especially. But people have, resistance that often, and gosh, I can't exercise. Well, we've learned that just moving throughout the day, because in the normal American diet, in the normal American lifestyle, with inactivity, poor food, toxic stress, all these things that people are involved with, you get medical conditions, all kinds of diseases throughout the entire body. But just moving more throughout the day, it doesn't have to be necessarily going to the gym, but there's things you can learn, and these are often outlined in aligned movement, for example, to find ways that you could just move throughout the day to get more fitness. But people have excuses. Oh gosh, I'm just too old to exercise and never done it before, and that's too late to start. We've learned that the human brain has this amazing ability, no matter how you are, no matter how much impairment you have, that it's never too late to start. It's always too early to stop, no matter what age you're at. They always say you want to die young, but that means you want to live as long as possible in a useful state. So never too old to be young. And the other thing people always state, and it's very valid, is that that certain exercise worsens their dystonia. And this is a diagram showing what people think that that even matter what exercise it is, whether it's yoga or stretching or light walking, everything. Certain people say that that exercise will worsen their dystonia, and some people think that certain exercises will help the dystonia. Now, our whole idea is how do we shift these lines over so that slowly over time and with the right guidance that we can shift it over so that these things that normally would have caused worsening of dystonia feeling are now helping your dystonia. But it takes effort, and it takes time, and we think about it as doing baby steps. You can't do it all at once. And so often people get really excited and they get into the gym and they're exercising or doing whatever, and then they get sore and they get worse and say, I can't do this. I tried it and I got worse. Well, you have to do little tiny bits at a time and set a goal. Even from my standpoint, I exercise every day, but I need a goal. I need some kind of a program in the future. I need a race or whatever to motivate. It's just human nature to give up. So, but you need that challenge, even no matter how little the challenge is. You need that challenge, and then that challenge produces that neuroplasticity, which then produces the improvement of your dystonia. But some people just need help. That's why we have a PERVA. And PERVA, as you said, neuroplasticity is the brain's is being blocked by my name, so I can't read it all here. But a second. There you go. The neuroplasticity is the brain's amazing capacity to change and heal with the right tools and guidance. We can rewire our neural pathways and transform our quality of life with dystonia. And so it's just human nature that people have trouble with getting going. So you need guidance, and so it's great to have people that really understand this. And so she has, programs that produce this sensory input, almost like the sensory trick, to again produce the motor outflow. And have you've been connected with her in the past, but this whole idea of having a personalized care program or a group-based program, something that gives you guidance, because even the best athletes in the entire world need a coach. I'm going to try to get my trying to get the, oh, there we go. You're going to get your faces back up again. There we go. So, so if you need help, the help is there. But, the idea is, you often can't do it alone. Oh, it goes. So, but we recognize that exercise is difficult. And so, and that's the whole principle of chemical, there's a word called hormesis. What hormesis means is that if we challenge your brain into some level, it improves your resilience to substance stressors. So being uncomfortable in the short term, it actually improves the more comfort in the long term. And there's all kinds of ways that you can get this good stress. See, there's good stress and bad stress. Bad stress is destructive on the human body. It causes inflammation. It breaks down your brain. There's a book that was just released a couple months ago now that we know a lot of this, but it's really nice summarizing all these health benefits of doing hard things, of things that are challenging to your body that produces a good stress. And there's ways of doing that, but recognizing that whole concept of what doesn't kill you makes you stronger. But at least there's a level there. Don't make these your last words. What doesn't kill you makes you stronger. So find the level of what you can do with more stress on your system. And we know that exercise, cold immersion, sauna, all produce some of the extra hormesis. But exercise and sauna take time. A lot of us, millions of us throughout the world, do cold immersion. Cold immersion is more difficult. You have to do 11 minutes a week, even in a cold shower or in cold water. I often do. But again, it's something. Then just one more example of something that produces a stress to the system that increases your resilience. And improves your pain control, improves your mental alertness, improves memory and sleep. All those things are involved with this whole concept of hormesis. We're talking about the vagus nerve quite a bit. I just want to mention it now because you'll see this word a number of times in the next few minutes. And you think of the vagus nerve as like a super highway of information in and out of your brain. Most nerves throughout the body could just go to one thing, like go to your face or go to your arm, but the vagus nerve is this network that comes out of your brain and goes to your heart and your lungs and your GI system and throughout your sensory system. And our goal is to improve that vagal tone. And we'll talk more about that. But you'll see this if you do some reading on this. You obviously try to improve the tone of your vagus nerve to calm down your brain. And one example is yoga. Yoga is a great way, and people think, oh, I can't do all those weird postures of yoga. Well, that has nothing to do with it. There's very specific postures that you can do with dystonia that all end up with the mind-body healing process of producing this increased vagal tone to lower your cholesterol, to calm your brain, calm the brain circuits. But you have to do it right. You can't go to some 20-year-old that's trying to put people through contortions. You have to go to someone that knows about dystonia. We're fortunate to have Jamie Jones here in the Gig Harbor area, who's one of the only people in the country that is truly dystonia certified for yoga. That is currently right at this moment down in Scottsdale doing further training on that. And she understands dystonia and has online classes. So that's a really good option for if people say, okay, I can't do very much. I can't go anywhere. Well, you can do an online program and just have with someone who really understands the limitations with dystonia and how we want to just lower that cholesterol level, increase our vagal tone. And so in dance, so everything doesn't have to be terrible, painful, with the exercise. Dance produces a reprogramming also. It's a great way and everybody has rhythm, and you don't have to be dancing in a perfect manner. It's just a matter of moving your body to music. That's all it comes down to. Dr. Farias in Toronto, he has really a big promotion of dance with brain health, and in NSTA, in National Spasmodic Association, now has the Move for Music program. It's in one of the recent programs or networks. So it's he has a yearly music for dystonia program. It's called Move to Music, and it's really again the whole concept of combining music and dance together to activate alternate circuits in the brain. So we're going to try to promote that more in our upcoming symposium that we have here in October. But it has benefits of balance, exercise, laughter, because you're not going to do it right. So it's, the matter of not being self-conscious about it, because it's all a matter of just what do you do to move your body to music, because music in itself is medicinal. There's a book that just came out again this past spring called Music as Medicine. And we know now that people enjoy music, but it's not just a matter of just enjoyment, like a just a something playful. It really does produce medicinal effects on the brain. If you can find the music that resonates with you, you have to find that right music that resonates with you. With that, it does you get a release of endorphins to help your pain, reduces your stress, lowers your cortisol levels, increases your neuroplasticity. And if you can do it in groups with music, it increases your social bonding, because we know social bonding is important. And here's one thing that is difficult, because so often people with dystonia, especially, can often don't get involved with other organizations and so forth. But that's the importance of dystonia support groups, dance groups, religious groups, book clubs, whatever you need, is bringing people together. We say we get sick alone and well together. And that's when the consequences of COVID. We had more involvement of people in our networks, in our support groups, before that time, and people got used to being on their own and doing things on Zoom and doing things with on networks without actually being present with other people. And I think that's being actually a negative health consequence that's maintaining today. Because they've shown scientifically that social isolation and loneliness have the same health risks, the same disease activation, even as smoking. So it raises a lot of negative things in our body. So we really encourage people, whatever they can do, to get into the right group that they don't feel self-conscious with, that they feel connected with, that actually improves their social bonding. And then laughter, and on that same line, if you get together with people, you think laughter is just something you do and you don't think about it, but actually laughter too is medicine. It does all the same things. Laughter actually triggers circuits in the brain that helps lower lower cortisol and the stress hormones, produces a relaxation effect. That relaxation effect can last up to 45 minutes. Even fake laughter. They actually have clinics where people do fake laughter. They're not really laughing at any joke or anything specifically, just practice laughing. And that actually triggers these circuits in the brain to produce that experience of joy, which is different than happiness. Joy is that internal sense of helping, of being helped, an internal sense of comfort that a person needs for their well-being. So so we always encourage people not, it's hard to do in general life, especially if you're miserable in so many ways, as so many people are, as we know, are with dystonia. But this is an old proverb from that we know. So it's a good laugh and a long sleep are the best cures for anything. So here we have all the science of all this sort of thing, but way back, many centuries, people recognize that there is in the 40 years I've been treating dystonia, and over the 35 years I've been treating people with botulinum toxins. I recognize that you can't just do it with medications alone. You have to do something else. The people that respond best to all these treatments and have best dystonic control, best pain control, are people that have developed the best lifestyle management to actually give more health to your brain. The healthier your brain, the better you can be, especially sleep. Sleep is really important. It produces a repair of the brain. You get restore the neurochemicals in the brain. And as everyone knows, on days that you don't sleep, you have worse dystonia days the next day. There's definitely a direct correlation with the neurochemicals in your brain and your level of sleep. And in the long term, it's extremely important because your brain has to release all these neurotoxins, these waste products in the brain. And it's called the lymphatic system. It's actually a lymph system basically in the brain that clears out the waste products, but you have to get into deep sleep for that to happen. So now we know that exercise a few times a week improves that. Even think that exercise in the morning or even sunlight in the morning will have an effect at night, but it actually has shown that the exercise in the morning, making sure that you have a regular bedtime and have meditation and calming music close to bedtime. All these things can promote the deep sleep, not just regular sleep, but deep sleep. Things like avoiding the blue light, very important. This is a hard lifestyle for a lot of people, is not eating within 3 hours of bed. But your gut needs health, needs rest, and your brain needs rest during that time. So try to avoid, the stimulation through eating before a few hours before bed. Avoid the stimulating TV shows, and avoid, of course, obviously avoid alcohol or caffeine that can aggravate your sleep. Many people bring this book up all the time. They just come to me and say, "Have you read this book?" And then this should be your homework if you haven't done so, because Breath is really an amazing book, and it really emphasizes this. Like it says, it's a lost art. People have known about the value of breath through through thousands of years, through Ayurvedic medicine, of the value of the right type of breathing for general health. And we've learned that for instance, just like nasal breathing activates the vagal nerve. Again, that vagus nerve is important. Make sure you breathe out. The exhalation part of the breath is the part that seems to activate the vagal nerve better. So, and nasal breathing is very important. We think, what difference does it make if you breathe the air in your mouth or breathe air in your nose? But actually, it's not just filtering out particles like through your nose. It actually is stimulating the nerve receptors that are triggering the vagal nerve, and improving your brain function. So breath is an exercise, a lifestyle. This is the lifestyle of learning to breathe and learning how to release the energy out of your brain through the right kind of breath exercises. It's pretty remarkable, and I've learned it subsequently. We all breathe thousands of times a day, but when you actually learn to do these breath exercises, it's pretty amazing what effect it can have on your brain. And in the same line is meditation. Again, providing this, no matter what the type of meditation that you do. Those of us who do transcendental meditation may focus on a mantra a couple times a day. Mindful meditation, maybe focusing on something more specific, but again, staying in the now and keeping your brain out of the turmoil of day-to-day life. But it opens your brain to more neuroplasticity changes, and it's been a lot of science, a huge amount of science. We could do there has been whole seminars on the neurological benefits of meditation. So again, we think of meditation as medication for dystonia. Releasing your stress, decreasing your cortisol, improving pain control, decreasing your dystonia activation, all come through trying to get into a lifestyle of trying to do the meditation for even 20 minutes a day, or if you can make it that long. But it takes practice. Some people, I just can't do that. My brain just goes all over the place. That's okay. You let it go over the place. You bring it back to the now, or to your mantra, or whatever you want to do. And there's all kinds of ways that you can get help with this, with tm.org, with transcendental meditation training, or the Insight Timer app is a very good app. The Calm app. If some people don't like the concept of meditation, different connotations, so they can call it prayer. That's okay, but it's mindful prayer rather than asking for something. As such, just having a peaceful time together that takes practice and patience, and improves your brain. And then we have nutrition. Again, each one of these things we can have a whole seminar on, but nutrition and the brain are definitely correlated. Often people don't think about that. Food goes in your stomach, it gives you nutrition, but you don't think about what direct effect is there from the brain to your gut. There's a book called Calm Your Mind with Food. There's a whole department of nutritional psychiatry at Massachusetts General Hospital, where they go. Psychiatrists are there where they actually treat people with their anxiety and depression disorders with the right kind of food to nurture the microbiome and to stimulate the vagus nerve. I'll come back to that vagus nerve again. Um, for instance, we need a healthy microbiome. And so we need to do that along with meditation, exercise, breath work. It all comes together. But we realize that there's more organisms in your body than there's cells. There's like you know I, sometimes up to twice as many organisms in your body as there are human cells, and they need to be nurtured with fresh fruits and vegetables and grains, fermented foods. All these produce positive effects on the vagus nerve and stimulate the brain. And eventually, and more important than anything, is avoid these ultra processed foods that damage the microbiome, and that can things that look like food but actually are most chemicals that too many people will eat. So avoid additives, avoid the artificial sweeteners, all these things that can actually impair your microbiome. And the last thing is your mindset. Uh, you think, wow, it's just thinking. What does thinking do to your brain? It doesn't do it. Just thoughts, right? No, we realize now that there's a whole department in Stanford where they study this and recognize that the mindset is a very positive, very powerful connection between your mind and your body, and it can produce what you think actually can produce physiological changes in your brain and in your body to produce physical improvement and improve control of dystonia. And so, because bad stress will universally amplify dystonia, a bad mindset will worsen dystonia. A good mindset actually improves dystonia. We have the adage that your DNA is listening to your thoughts, because they've shown that attitude and positive thought can actually produce epigenetic changes, actually positive changes in your DNA to affect how your brain works. So it's thought energy can affect how the genes are expressed with the right type of thought. But you need that, and that's easier said than done when you're suffering with so many different things. But working and just one more lifestyle exercise to work on the positive attitude and positive thought pattern to help promote healing. Just this whole mindset of expectation of healing, the whole placebo effect. Placebo effect is not some trick. Placebo effect is really really a positive, amazing electrical change occurs in the brain that they've shown actually, just by having the expectation of healing, of knowing that I want to get better and having a positive attitude towards that treatment, actually improves the results of that treatment. And having a negative effect, oh, I'm sure if this is going to work, this is not, this sounds hokey, I don't think it's going to help, actually decreases the effect of what a medication or treatment would be. So that's the whole idea of maintaining a positive effect on healing is another part of our important part of our lifestyle. So here we are, that the whole lifestyle measures of your brain health. Exercise and medicine improves neuroplasticity. Sleep improve your brain neurochemical function, remove your waste products. Your food to suppress inflammation in your gut, improve your microbiome, produce that connection to your brain. And then all these things that help calm your brain with meditation, good stress, positive thought and attitude, all result in this healthier brain and in a calmer brain, which then calms down that energy is producing our dystonia. So the lifestyle medicine organization has this mnemonic of meds. If you have trouble remembering all that, medication, exercise, diet, and stress. If you can remember meds, you can remember all the different aspects. So you can see there's many pathways that you could help your brain in dystonia. And also, just aside, it's not just your dystonia. It's anything related to your brain. For example, Alzheimer's disease. We all worry about Alzheimer's. and as years and years go on, it's devastating. But now they know that at least 60% and even up to 90% of people, if they practice good lifestyle choices long term, can prevent Alzheimer's disease from occurring, even if they have a tendency toward that disease from occurring. Because once it happens, something happens in the brain. They're not sure what it is, but once it happens, all these changes don't seem to make a difference. But preventatively, if we can do all these things we just talked about with good lifestyle choices, we can help prevent um, diseases of the body, because they've shown that the health span, how well you do long term, is only about 25% genetics. 75% of how not just your lifestyle or your longevity, but your health span, how well you maintain healthiness throughout your life, is related to lifestyle. And so it's kind of the whole idea is how you play the hand that is dealt. You can have the same genetic activity, but you can change that with the right type of lifestyle. Take care of your body. It's the only place you have to live. This is up in Whistler. I saw this. So we don't have a lot of time probably for questions, but whoops, I didn't write it down. Oh, I thought it came up here. But I was going to have people email me if you have questions. My email is Hogan, that's Hogan, and PSN, Puget Sound Neurology, Hogan PSN at AOL.com. If you have questions, things that come up about lifestyle management or things along this line, if you have ideas, definitely contact me. You can contact Apurva. There's so much more to this and so much more you can read. And just a lot of this was meant for motivation and inspiration to know that you really do have a capacity of, no matter where you are, of making things better. This is not going to be the end result of a cure, but it will definitely improve whatever treatment that you're involved with. All right, thank you.